Welcome to the Second Reading Podcast from the University of Texas at Austin.
The Republicans were in the Democratic Party because there was only one party.
So I tell people on a regular basis, there is still a land of opportunity in America. It's called Texas.
The problem is, these departures from the Constitution, they have become the norm.
At what point must a female senator raise her hand or her voice to be recognized over the male colleagues in the room?
And welcome back to the Second Reading Podcast for the week of August the 2nd, 2021. I'm Jim Henson, Director of the Texas Politics Project at the University of Texas at Austin. Happy to be joined again today by Josh Blank, Research and Polling Director for the Texas Politics Project. How has your morning gone, Josh?
I would say pretty productive, pretty nice.
Yeah. Well, productivity, what more could we ask in this society?
So, yeah, I don't, well, I mean, okay.
Well, though there's plenty going on with the continued stalemate at the legislature, with Democrats at this recording still in Washington, D.C. and waiting out the return or the end of the session, of the special session this Friday. We return today, unfortunately, I think, to the politics and policies around the COVID-19 pandemic amidst a clear, serious uptick in cases as a result of the spread of the Delta variant of the virus. So, we should talk about where we seem to be now in terms of response by state and local governments, which have been, as during earlier phases of the pandemic, quite different and at odds here in Texas. But I want to start with some of the basics in the pattern of public opinion that we know about up to this point, and some of the baselines for thinking about where we are in this new phase. And we can circle back and talk about what's happened in the last couple of weeks, mainly Governor Abbott's response, which has essentially doubled down on the strategy that we've seen for, really the last year or so from the governor and state government here. Now, for this discussion, we can draw on trend data that we've accumulated since we started polling on the pandemic back in April of 2020, and we do this because the responses we're seeing so far to, spoiler alert, seem based on the established patterns that we've seen. It looks, unfortunately, like the virus is changing and adapting much more rapidly than the political system is, certainly in the state, arguably maybe even in the country. So what have we seen? We've seen a lot of things. Let's start with the overall sense and attitudes and behaviors that, that within the data we collect on those things, we saw that overall concern kind of had plateaued and maybe even was declining when we were last in the field of June of 2021 for the UT Texas Tribune poll. I'm remembering that.
Yeah, I think that's right. I think the way to think about that, I think is really social sciencey response to this in some ways. I'll put it out there.
Social science.
I know. I'm sorry.
No, it's good for everybody.
No, it's not.
Science.
Well, okay, it's not always good, but there is something here that's sort of we say there's sort of a difference in the intercepts, but not necessarily the slopes. Democrats started out significantly more concerned. So where they began was much higher in terms of concern than did Republicans. And so you can kind of look at the state as a whole. And when, we started polling in April, about half the state was
April of last year.
April of last year. Yes. Half the state was extremely or very concerned about the spread of COVID in their communities. But this was only 36% of Republicans and 76% of Democrats. Now, over time, both groups have declined, and we go, to June of this year and this summer. And 27% of the state is extremely or very concerned about the spread of COVID. Now, this was before, I think, the uptick in cases and the Delta variants. We have to make that clear, although the Delta variant was still spreading at this point. But I don't think we saw the sharp uptick that we've seen in recent weeks affecting this data, which was collected before. So again, in June of 2021, about a quarter of the state thought it was serious or extremely or very serious or very concerned about community spread. And that was still half of Democrats, again, down from 76% in April 2020. But it's also down to 10% of Republicans from April 2020. So even though they started a lot lower, being about a third of them who were very concerned, now it's only about 1 in 10. And this is kind of the trend. The interesting thing is going to be when we poll again, honestly, is it wasn't as though it was a straight line from high concern down to low concern, because there was an uptick in February of this year, which was when we actually saw the first emergence of these new variants. Right. And I think when that happened, ultimately people started getting a little bit more concerned because there's a question at that point. There was a clear question of do the vaccines work with these variants? Are they going to spread faster? Is it going to affect people
Well, and there were
differently?
two things going on in February too, right? Because the variants were beginning to emerge, but we had also seen the holiday surge, right? So if we overlay this, so those two things were, I think, working together.
Right. But the point is that, the gaps in opinion and attitudes have never gone away. So even though we do see, a decline in concern overall, there's still, wide gaps in terms of both how people view the virus, the threat they think the virus poses to them, but also, not surprisingly, then the response of people to the virus. And so, as we started to kind of ask about, basically whether you're living normally is kind of the one we always lean back on to see who's gone back to sort of feeling like they're living normally. The share of Texans who say that they are not sort of avoiding public places, that kind of stuff, and really just kind of living their life has continued to go up over the course of the pandemic, but it's driven almost entirely by Republicans. Democrats are getting more safe as they get more vaccinated, but overall, despite the fact that vaccination rates are significantly higher among Democratic than among Republican voters have been the ones who have been the quickest to re-embrace life. And in a lot of cases, and this is what's, I think scary, I guess the best way to put it, it's not only Republicans who are embracing, living life normally and engaging in a bunch of activities, but it's actually, unvaccinated Republicans who are the most likely to be engaging in normal activities and really eschewing most social distancing guidelines that, we're still kind of relying on at this point.
And I think that intersection between, actually, I should say for people listening also, if you're interested in these trend data and kind of following along at home or looking at it after you hear the podcast, we've got a not being very humble, what is a pretty good post and an interesting compilation of the trend data on a lot of these measures that we'll be talking about at the Texas Politics Project website, which is at texaspolitics.utexas.edu. If you go to the polling section, there's a blog section and there's a post from July 1st. What I'll probably do when we're done is post a version of this podcast in the blog section of the website where a lot of this stuff is in one place, or at least a link to that so it's easier to find.
Well, and I'll add what's really good about looking at that is we're obviously focused on politics, and I make no, this is the Texas Politics Project, so I make no, apologies about that. But what's interesting about looking at that trend data is it also breaks it down by race and by geographic density, so urban, suburban, rural, and so you can kind of look at a lot of these trends that I think are, often reinforced by partisanship, but it's not entirely partisanship, and it's not necessarily the case that people getting vaccinated or not is all about one story. It's a couple different stories going on here.
And this is a story that I think is very live right now. I mean, what are the reasons, even though in some ways the main headline story in the state right now, or the storyline, if you're really following inside politics and institutions in the state, really is what's going on with the legislature. But one of the reasons I decided we should go with this today, it really is that, it's striking how dominant the storyline is right now. And we'll get the talk, you and I have talked about this and the way that, and I think there are reasons for that have to do with the difficulty of sorting it out what to do other than, in addition to the politics of this.
Well, you and I were joking a little bit yesterday, but it's hard not to watch, the Texas I don't want to say twiddling their thumbs, but twiddling their thumbs during, more or less during hearings about, college football realignment at a time when, this is clearly a dominant public health and public policy problem if we would allow it to be. But we're just kind of going along as if it's not happening. And I think part of what's interesting is, the underlying attitudes kind of explain that. To a large extent, right?
Right. Well, yeah, we might as well just talk about that. Yeah. It's almost impossible I shouldn't say impossible because people will do it. But if you look at the trends in this data and you look at how consistent, as you were saying at the outset when you were describing the concern data, but across almost every measure, how both consistent and persistent the partisan gaps in attitudes towards the virus and behavior are. Without making excuses for, what I have to say is, pretty questionable public policy in the state right now in terms of, at best kind of ignoring this and at worst pushing against it. If you want to explain politics through elections and following your base and responsiveness and partisan responsiveness on the part of elected officials, boy, this is your issue.
Yeah, I think that's right. I mean, and if you go and you kind of look across our data, I mean, one of the things that I think I kind of keep leaning back on in all of this is, we asked back in March about approval of Governor Abbott's decision back then to lift any restrictions on statewide business, basically prohibits, restrictions on businesses due to COVID, and to lift any mask mandate statewide. And if we look at, the prohibition on business restrictions, we have 78% of Republicans approved of that decision, 62% strongly approved. So it wasn't, there's not a lot of sort of middling opinion on this. 85% of Democrats disapproved, 74% strongly. That's on business restrictions. On removing the mask mandates, pretty similar. 76% of Republicans approved, 60% strongly. 88% of Democrats disapproved, 81% strongly. And this was back in March. Now, again, I like to be cognizant of the fact that there's a shifting underlying landscape. And the truth is, I think a lot of criticism that people are making about, I would just say inconsistent messaging from a number of institutions, organizations, the CDC, the federal government, local health officials, et cetera, has made this, a difficult situation. But the other thing I would say is, even back when, the coronavirus was peaking at a higher level than it's currently peaking now, or even back when it was peaking at a similar level to what it's peaking now, if we go back to last summer, and then we think again about the surge that came after that, and a question that we were asking repeatedly, and we've since stopped, was, what's more important here, basically helping the economy or containing the virus versus, containing the virus, even if it hurts the economy. And pretty much without fail, every time we ask that question, close to, about 70% of Republicans say you have to prioritize the economy. And I don't, and I'd say is, even with the surge of the variant, I think, if you're a Greg Abbott, I can, construct a pretty clear narrative that says, hey, look, I know what the majority of Republican voters want. I know that the majority of them, even if they're not getting vaccinated, are living normally, and they don't want me to be the one who tells them, no, don't do that anymore. They want to prioritize the economy. And then, just to be fair, at one point, we do have a vaccine now. And a lot of people, not them, are vaccinated. Which does a couple of things. One, it does decrease, the likelihood of people getting severe illness and overwhelming hospitals, and I think, but it also, significantly decreases the likelihood of death. And so, when you're trying to sort of weigh out the political calculus here, I can kind of see how we get to the place that we're at, because I don't think there's much appetite. I would say there's very little appetite generally to go back under more restrictions, but certainly almost none among Republicans. But further, the situation has changed such that I think, we've already accepted so much suffering and death, in some ways. It's almost like, well, I guess we're going to have a little bit more, but the trade-off is we're not going to restrict the economy, I guess.
Yeah, I mean, I think that is a pretty, at first,
Sorry.
No, well, I went from, in listening to you say that, first thinking, well, that's, maybe a kind of cold-blooded assessment, to then me thinking, well, maybe that's a little charitable. But I mean, I think,
well, then great. Okay, I'll take that. That's what I shoot for.
Well, but I also think that, another branch of you talking about the uneven messaging and the trajectory of this is that, it has turned out to be relatively difficult to predict how this was going to shake out in some ways, based on the short-term response of folks. I mean, as you mentioned in your comments there, I mean, there was a point when people were saying, well, we've got a vaccine and the vaccine seemed to work and distribution seems to be going after, shaky beginning a little bit, fairly well. And people were saying, well, the risk of the virus end is lower, and it's reduced. And so that's bound to affect people's views on the economy. But as we look at the cases begin to increase again, and we look at, the fact that you and I wrote about back after the April poll that, once the vaccine got into circulation, it became clear that, the more and more and now it's up to, the high 90s, the vast majority of people that are still requiring hospitalization and are still getting seriously ill are people that have not been vaccinated.
Right.
And so the problem with that is,
Here we go.
At some point, somebody has a responsibility, it seems to me, to say, and hey, you know what? If we want the economy to come back, we should do everything we can to get the vaccination rate as high as possible. And I think the rhetoric that we've seen has been reflective of a different set of priorities than that, frankly. So just, we probably should have done this at the beginning, just to recap. And this is maybe an unfortunate time to do this, but fair is fair. So, last week, Governor Abbott's initial response to shifts in the CDC guidelines that you were talking about that were admittedly a little muddied, but that were basically saying that people should increase, their mask wearing, and that there was an increased threat, and that there were indications that vaccinated people could, at a very, in very rare cases, have what they call breakthrough cases and still get the virus anyway, but that the infection would not be serious to the person that has it. But in addition to that, that people that are vaccinated and, as I understand it, get infected with the virus still spread the virus at about the same rate as unvaccinated people. Now, look, that's complicated. I'm willing to, but governing is often complicated. And
right.
So, the initial response to these guidelines in the state was for, the governor to reiterate what has become the party line, first on Twitter and then in orders, to the state. And to quote the governor's tweet, he said, "The time for government mask mandates is over. Now is the time for personal responsibility." A couple days later, the governor underlined that message with a new general order that consolidated previous orders and reiterated that business, quote unquote, business activities and legal proceedings are free to proceed without COVID-19 related limitations imposed by local governmental entities or officials. And then also that no governmental entity, including a county, city, school district, or public health authority, and no governmental official may require any person to wear a face covering or mandate that another person wear a face covering. Now, I think if you ask the question why to that, there's really only one answer. And that answer is the politics of the situation, because and you can say, well, it's principle. Well, those principles are not universally shared. We now have volumes of data showing that principle is a principle that's embraced primarily by partisans, to the extent that nobody should be able to tell me to wear a mask if I don't want to.
Right.
And, the personal responsibility, the balance of personal responsibility and the concept of public health here, seems to me to be very shaped by the politics of the situation. And I find it hard to find, I find I'm not seeing a more persuasive explanation than that.
No, I don't disagree with you. And I think I'm thinking about how to say this, and it's not even, it relates to the politics, but it's another aspect to this that I think, which is, there's sort of a well, now that we've done this, we can't go back kind of mentality to this in some ways, which is, well, look, if we look at the data and we look at the curves, the idea is once we've blown past, a red line, as we say, well, then what difference does that red line make? Right. And that's kind of been the way this pandemic has gone here in Texas, which is, we say, well, if positive tests go above this, we're going to have to start to do something. And then it's well, actually, once positive tests go above that, we're no. If a total hospital capacity, ICU beds goes above this, it's okay, well, the ICU beds are going up. It's okay, no, total hospital capacity. It's okay, well, sure, And now here we are. Again, there was a trigger that would have allowed some of the regions to impose, or counties to impose more mandates if the share of the hospital beds in the county regions that they're doing this calculation exceeded, I think it was 15%. One of the regions already had, a couple were approaching it and probably will pass it, and the governor said, nope, we're not doing that anymore. Now again, I'm
something else that was undone in the executive order.
And I'm very cognizant of the fact that the situation has shifted. I think what's interesting, but I think, it's interesting we're talking about this, all the uncertainty and the shifting underlying thing. But the thing that hasn't really changed is what we started with, which is the underlying attitudes.
Right.
And ultimately, that's what shapes the political response that you see from the elected officials is, what are my voters going to think about my response to this? And as we've blown through these various kind of red lines, these various, instances in which we would expect more government intervention, well, we're out. I mean, at this point, it's kind of like, well, can we go back now and say, well, now we're going to do mask mandates? Because ultimately, if you think about all the heat, Abbott got for the little bit of, the brief period of time in which there were some statewide restrictions, the idea that now, if he were to go and say, okay, you know what, we're going to start allowing masks, or we're going to start allowing whatever, maybe in certain areas, certain regions, who knows, somebody from the dissident right-wing Twitter universe, I mean, in fact, I could probably think of a couple people, would put up a picture of the graphic of COVID cases and say, why now? And, I don't know what the answer to that would be, other than, well, now I've decided to follow good public health advice. But that hasn't been the case up until this point. So I don't see, why they would shift back to that now.
Well, I mean, I think that, if I was to argue the why, I mean, I might, and look, I agree with what you're saying, that is very likely the reasoning that's going on there, that there is a, I mean, if anything, what we saw last week was and this week in the, the melding of the immigration, this was also last week, but it's still carrying on this week. But the melding of the immigration general order that the governor issued, that being rationalized by the spread of COVID, is I'm sorry,
laughable. If it weren't so sad,
it just underlines, what you're saying, which is once, there's a certain sort of commitment. And this is where I just find it, I get the politics of it in strictly bloodless or bloody political terms. The situation is different than, in a number of ways than it was before, in terms of context. And, there are openings here. And I think that, that this comes back to some degree to something that we were, that we discussed. I think we wrote about publicly at the very beginning of this, is that, the governor has a lot of political capital and a lot of, literal, campaign funding, actual capital. And I don't know that if spending some of it here wouldn't in the long run be okay. Particularly given that, look, I understand that, I mean, the two main primary challenges that he has right now, for all people talk, about this in general terms, were likely, germinated in those few months where the governor was trying to split the difference on this and trying to respond, in terms of public health. I mean, that is when Alan West, got the bulk of his press. It still remains, to some degree, the core of his challenge, very similar with Huffines, his other primary challenger. At what point do you, how secure do you have to feel in the face of those things? There's a big story in the Statesman that Nicole Cobbler wrote, which talked to Mark Jones and a couple other political scientists in the state. And I think both Mark and somebody else, and forgive me if you're out there, I can't remember who the other person quoted was, both characterized the governor's position on this as gambling that the pandemic is not going to get worse this time, that this peak will be not what the other one was.
I don't know about that.
It is a gamble, but I think, if you're playing on, experience, well, his experience has been that for all the criticism he took, jogging right has helped shore up his numbers.
Yeah. And ultimately there's no limit to the number of other actors that he can point his fingers at around this. He can point, and he's doing it, right? He can point it at local governments and local government mandates that are, he could say detached from the science. He can point to undocumented immigrants. Now he can point to the federal government. And so there's lots of other places that he can muddy the water on this. But I mean, that's a funny way to put it, this idea that, he's calculating this out, because I was sort of thinking early on in the pandemic, going back to sort of when there were these clear sets of guidelines. Okay, if this happens, we're going to have to, basically shut down a little more. And, when they were really kind of being serious about following some of the data and then basically decided to start ignoring it. I mean, one of the things that I was wondering, talking to reporters at that point was did anybody do like a cost benefit analysis to like how many more lives this might cost? And I mean, it was a serious question, because I think
Ray
honestly,
Perryman might have been busy.
there are a lot of people modeling, right? A lot of people saying, hey, look, we know this could have, a lot of people were doing this at the time, seeing kind of what the effect of, some strong social distancing, weak social distancing, all that kind of stuff might have. And I mean, it was pretty clear at that point in time that, whether they looked into it or not, how many additional deaths opening up the state would cost, that was a pretty big surge, and we're already through that.
Yeah.
And so I don't see the cost here being significantly higher. I mean, I think, as someone who studies public opinion, one of the things that I'm kind of like maybe a little desensitized to is how rarely public opinion shifts.
Yeah.
Dramatically. I mean, when I see, a big shift might be, maybe you see like a 5 to 10 point shift in a brief period, but a lot of times it snaps back to where it was if you check it again later. And so you don't see these big, like, massive, like 20, 30 point shifts in opinion. It's not like, if because of the Delta variant, we see the surge continue up, and let's say, we shouldn't see as many deaths. I mean, that's what, because of all the vaccinations. But let's say we see a surge, a continued surge in cases, and we blow past, last July's surge, and we're looking somewhere in between those two. And the idea that all of a sudden a bunch of voters are going to say, hey, this is mismanagement.
Yeah. And I think it's worth talking.
Happen.
I think it's worth talking a little bit about just the experiential part of this beyond the policy piece. I mean, you and I were talking about this. It was I don't know if you went back and saw it. There's a good piece in the New York Times over the weekend that talked to a lot of people about their hesitation or their refusal to get the vaccine.
Mm-hmm.
And there was a lot of interesting decision making going on there, and a lot of, some of it is personality, some of it is political belief, some of it is how people process risk.
Mm-hmm.
And I think that is to some degree underappreciated. But I also think, again, it does come back. I could get away from the politics for about 20 seconds. But I mean, I think even though public opinion changes, public attitudes don't change very rapidly or very much in a lot of cases, amidst a lot of uncertainty, we do know that leadership matters and elites, signaling by public officials matters. Now, it may be that we're just too deep into this now
mm-hmm.
for that to be much of an option.
I don't think so.
But I think the stakes are high enough that I mean, what would happen if for the next 2 weeks, all the local news channels in Texas broadcast PSAs by a wide variety of Republican officials saying you should get vaccinated. And until you get vaccinated, you should not go out. And that's just because we all want the economy. In other words, a message was crafted that attempted to consciously not run away from people's opinions, but engage them and see what kind of effect you could have. And look, national Republicans were clearly thinking this 2 or 3 weeks ago, because we saw a little uptick in a lot of congressional Republican leaders doing exactly that, going perhaps not exactly that with frequent PSAs, but certainly going on the record in a very public way in urging people to get vaccinated and urging their constituents and their partisans to get vaccinated.
Yeah, I mean, thinking about the New York Times article and all the reasons people give, it reminds me of something that I think about a lot, which is, life is aggressively contextual. And it's one of the limits, I would say, public opinion doesn't shift that much, but it's actually very easy to shift behaviors in the short run and in a very isolated way and in very, consequential ways. There's a whole, it's what behavioral economics is basically all about, right? I mean, how you ask the question might lead people to do completely different things, right? What the default is, that kind of stuff. And so I think, that does matter, but that's sort of where, that is where, beyond just the words of, politicians, that's where I think what you see in that article, and I think what is so vexing about the state response, which is to say, basically to state, local governments and really as many entities as it can, you cannot do anything to try to compel people to do the right thing here. But the thing is that, ultimately, if your job requires a vaccine, and you're kind of on the fence about it, you're probably going to get a vaccine. If your kid's school requires you to be vaccinated to come in and pick your kid up or go to the performance, that's probably going to get a couple more people vaccinated. And ultimately, this is kind of where we're at right now, is we're trying to find the people who, for whatever reason or not, what extra little nudge is going to push them over the edge to do what needs to be done so this doesn't happen. And the problem with, the political construction that we're ending up with is it's funny at the same time as I think, just talking about the Republican Party here, I'm not making a comparison, as the Republican Party is sort of, I think over the last few years, thrown away a lot of sort of core tenets that I think you usually think of as being part of the Republican Party. This construction around social and personal responsibility is just kind of a really odd one for this situation when it's a public health crisis and the consequence is public.
Yeah.
And you and I were talking about this, and to bring social science back into it one more time, this is a collective action problem, and it's a problem with what we call free riders. Ultimately, a collective action problem occurs when there's some kind of outcome that we can all contribute, to, but our contributions are so small or significant that whether we contribute or not, the outcome is going to happen either way. And so it leads to the situation where we're free riders. The classic example is like clean air. If we're all going and we're contributing, to basically making the air cleaner by whatever, not like burning our garbage outside, but you decide, I'm going to burn my garbage outside. Ultimately, you still get the benefit from clean air. You're a free rider. You don't have to do what everybody else is doing, taking their garbage to the dump, all this stuff, whatever, right? And I was thinking, with where we are right now, we're in the situation that's just, as I described to you before, it's like one of the most horrible collective action problems you can think of, because essentially there's a couple things for, I think, again, the majority of people are vaccinated, and probably a lot of people who listen to this podcast, right? Essentially you have to worry about yourself, as we all do. We're all egotistical. You should worry about yourself, otherwise you wouldn't live. And, the main question here is, have you gotten the vaccine or not? If you haven't, significantly increases the chances that, something bad is going to happen if you get COVID, or, take the vaccine will significantly decrease those chances. Next, you say, well, what about my family, my close associates, my relatives, people I'm going to interact with a lot? Are they vaccinated? Well, if they're not, and, you get it, or you get a breakthrough infection, you give it to them. Well, they may get seriously ill. They may die. They may have long COVID. Who knows, right? So there's that. But maybe everybody that you interact with is vaccinated for the most part. Not uncommon with the way that social networks work. So that brings to this other issue, which is like, well, what if I go out and I happen to get it? I'm asymptomatic and I give it to somebody else that I don't really know who's unvaccinated. Well, meh. That depends on your moral, fabric and fiber and how you feel about it. But the biggest thing that I think, people should be concerned about is this idea of, as long as this virus sticks around, we're going to have more variants. And eventually, if we keep having more and more variants, it's more likely the variant will come along that, proves to be able to overcome our vaccines.
Yeah.
But here's the thing though, the individual action of you or me or any one of us is not going to necessarily contribute to that variant, but the collective action of the entire society is, which is why this whole idea of like personal responsibility becomes a bit of a problem, because ultimately my decision is not going to affect whether or not, there's a new variant of the coronavirus that puts us all back into lockdown, for an extended period of time. It's the collective decisions of millions and millions of other people. And that's why that messaging is just so off.
Yeah. Well, and I think that, we're going to have to wind it up, but I think, where that leads us is that, public health is a public good.
Right.
Right. And particularly then vulnerable to this collective action problem. And I think that outside of that decision-making logic, which I agree with, there's another kind of broader cultural, ideological dynamic going on right now where I think that, and then the recourse to individual responsibility, I think, is one aspect of this. When was the last time you really heard the governor utter the words public health other than talking about an entity? I think that, the kind of polarization among and this kind of sense that, as a result of negative partisanship laid onto this ideological construction that Democrats have become socialists and all of this, that it's harder to talk about the notion of public health right now. And for Republicans, and they're hesitant to do that for the political backlash that's gonna come at them. And, the notion of public health sounds like, you're being a socialist, or it's something out of the New Deal, or, something like this. And, it's really getting in the way of messaging on something that is, that because of the mechanisms you're talking about is going to continue to be a problem for a while if we don't reach a higher threshold of different kinds of behaviors and a higher threshold of vaccination.
Yeah, you could imagine a scenario in which you just say, do it for yourself, do it for your family, do it for Texas, do it for the country.
Yeah.
And it wouldn't even be that hard, right? We just passed a law requiring the playing of the national anthem. It's a patriotic thing to do, and there's a little bit of playing with that. But, going back to personal responsibility, ultimately, I think, what we talk about in social, again, activates the idea of it's a personal decision.
Right.
It takes it back into whatever sort of, whatever considerations you have to bear in your context.
And if it's not left to that, it's a violation of that, rather than being weighed in the context of something else, which we do all the time.
Which puts us at the status quo that we've been at, honestly, almost the entire time we've been asking questions about people's vaccine intentions, which from the start has basically shown about a third of Texans who are going to say either unsure or no. And that hasn't budged.
Yeah, and I think, it will be interesting to see whether the latest, where we are now, if there's any chipping away, and this is kind of what we're seeing some anecdotal evidence, but I'll be interested to see what the actual, epidemiological and medical evidence looks like, and what the polling looks like when we're back in the field. We're chipping away at the unsures, I think, a little bit. Right.
Yeah.
And that's kind of what the New York Times thing was getting at. But there was, I think the anecdote I shared with you is the guy that just said, yeah, why did I wait? Oh, I don't know. I kind of wait for everything. I'm just not an earlier adopter. And look, there are some people that are going to be out there like that, particularly young people. And that's understandable. But I think, if anything, what we're seeing right now is that there's really got to be an effort to go after those people, even if there is some political cost among the people that are just like you, even talking about making me do this pisses me off, and those people seem to be, having, to my mind, an undue influence on the public agenda and on public health in the state. With that, I think we've gone a little over. I want to thank Josh for being here and for all the prep he did and gathering data on this. Thank our excellent folks in the Liberal Arts Development Studio in the College of Liberal Arts at the University of Texas. Thank you for listening, and we'll be back next week with another Second Reading podcast. The Second Reading podcast is a production of the Texas Politics Project at the University of Texas at Austin.